Thank you for choosing Mary Washington Healthcare's Joint Care Plus program for your joint replacement. This video will give you the information you need before and after your surgery to help make your recovery as quick as possible.
Our program is structured so that it's a smooth transition from the time they see the physician through the process of surgery and then recovery as well. If you look at over the years that we've been doing this, we've had successful recovery with minimal complications, and patients are very happy with the procedures they've had.
Prior to your surgery, your physician will likely refer you to pre-admission testing. You will set up an appointment 2 weeks in advance of your joint replacement. On the day of that appointment, you should bring the joint folder as well as the original paperwork inside the envelope you received from your physician.
Pre-admission testing is to preemptively strike anybody who might have some complications so that it's a smoother transition into surgery. And what they'll get there is an extensive background. So they'll do a lot of vitals, they'll look at their medical history, they'll ask them to get some lab testing done, look at any contraindications for surgery, and then make sure that everybody is stable and safe. The day of surgery, they typically will come into the admission station, they'll check in at the desk, they'll be escorted by one of our volunteers up to the surgical center.
They go to same-day surgery where the same-day surgery staff starts IVs, they get them ready for surgery, they go to the OR, they have their surgery, and then they come out of the PACU. They stay there for approximately about an hour, and then they come to the floor.
Within an hour of arriving after your surgery, you will be evaluated by your physical therapist, who will go over the plan for your recovery. That will include a few of the exercises you will be doing in the hospital and at home.
We work with ankle pumps, so moving their foot back and forth, trying to get their calf contraction, knee straighteners or quad sets, so they're tightening their thigh muscles up, and glute sets as well. So we're actually motivating movement through the joint and blood flow through the joint to help with healing.
If you arrive on the floor prior to 4 p.m., you will get up and get moving.
We get the patients out of the bed, we take them and ambulate them around as far as they are able to tolerate it.
The research has shown, and it's best practice around the nation, that earlier intervention promotes earlier discharge, faster recovery, and really that's what we've seen. Our length of stay is reduced. We're about 1 to 2 days length of stay at this point.
The day after surgery, with assistance if necessary, you will walk to physical therapy. It is important to remember to bring the proper clothing for exercise, sneakers of course, as well as 1 to 2 outfits. Shorts or sweatpants are recommended, but make sure there is no elastic around the ankles. Once in physical therapy, you will join a number of others just like you for group therapy.
The therapist will work with the patient in that group therapy class. They do exercises that they should be doing at home.
There's a great camaraderie. Everybody's doing the same thing. We're doing leg exercises. They do car simulators, stair training, bed training. They work with our PT and our OT teams to move forward with their functional outcomes to make sure we're optimal when we discharge them home.
It's really important for the patients, once they do go home, to continue those exercises so that they have full range of motion, so that they can do everything that they want to do.
My statement is this: you're going to do very little with us and a lot on your own. So if it's not for the homework, this isn't very successful. So we drill homework in on that day of the evaluation. You have to start doing more on your own. The coaches class that we have is a separate entity for family members to come together so that they can get an education on various things.
It goes through what the patient actually had done so that the caretaker or the coach can understand what the patient has gone through and how to help them.
There's education on homework, making sure they get their exercises done. Discussion on home environment, making sure we have the house well lit, make sure there's no tripping hazards, making sure cords are placed strategically, making the home safe.
In some cases, patients will need to go from the hospital to a rehab facility. In most cases, patients will go home. In all cases, patients will have a discharge plan.
We always want to make sure that the patient's taken care of safely. Ideally, we want the patient to go from here back home. If the home's environment is such that a patient is living alone, the case managers are alerted, hey, this patient may need additional help.
Discharge planning starts on the day of admission. The case manager will go to the patient's room and talk to them about home needs, if they're going to need PT, if they're going to need home health, and they start to facilitate any medical equipment that they would need, a walker, a bedside commode, or anything like that. The Joint Care Plus program is amazing. I love seeing patients who have had difficulties and we basically get to fix them. They get back to where they feel like they should have been prior to the surgery.
The Joint Care Plus program to me is to put it into words, my life. It's just good to see good people that need something to be able to help them get back doing what they want to do, if it's a cruise or if it's riding their motorcycle or dancing with their wife. You know, I like to be able to help them be able to accomplish those goals and get back to the life they want.